How do neurosurgeons treat epilepsy in Turkey? In this video, we will talk about a relatively new method, NEMAD deep brain stimulation. What are its advantages, how effective is it, and is it suitable for everyone suffering from epilepsy? We will get answers from a neurosurgeon who uses brain stimulation to treat various neurological diseases and sees patients in Antalya, Turkey. Subscribe to our channel, where we explain here how medicine in Turkey can help even with the most serious illnesses. Epilepsy is a chronic brain disorder. Its manifestations include seizures, convulsions, loss of control over parts of the body, and even loss of consciousness. Epilepsy is one of the most common neurological disorders. According to the World Health Organization, about 50 million people suffer from epilepsy. Patients with epilepsy turn to Healthy Turkiye for assistance quite often. Epileptical seizures are the result of excessive electrical discharges in a group of brain cells, and they can occur in different areas of the brain. To treat epilepsy means to prevent these seizures. The first step is taking medication, anti-epileptic drugs. In different cases, they vary, but up to 30% of patients do not respond to medication at all. The second method is surgical, removal of the brain area from which seizure activity impulses originate. Such an operation is possible if the examination can identify the area responsible for the seizures and if it is small enough and not associated with vital bodily functions. The third method is the reduction of epileptic impulses through electrical impact or brain cell stimulation, and it is already being successfully applied in Turkey. An electrode is placed in a specific part of the brain, and this method shows quite good results, but it is not yet widely used. Professor Tanju Uçar, a neurosurgeon specializing in neuromodulation, graduated from Cerrahpaşa University in Istanbul, studied at the Department of Neurosurgery at Emory University in the United States. Specialized at the Akdeniz University. Since 2000, he has been engaged in scientific and teaching work here, including more than 12 years as a professor. Member of international and national professional associations, often serves as a guest expert in the media. Nowadays, we can increasingly hear about the Neurostimulator. This is a relatively new medical technology. How much has it been developed? How far has it advanced? And has it overcome its initial challenges? Or should this field still be considered experimental? In fact, the use of neurostimulators in medicine began a long time ago. Their principle of operation was tested as far back as the 19th century, but these were completely different types of stimulation. And if we talk about modern treatment methods, the emergence and development of current neurostimulation techniques actually began in 1987. In that year, the scientist Alim Benabi in France, in the city of Grenoble, applied deep brain stimulation for the first time, which we abbreviate as DBS. And after that, the technology of neurostimulators began to progress very rapidly. Gradually, it began to be used in the treatment of many diseases of the brain and spinal cord. Previously, these systems were much larger and operated more slowly, but gradually, with the development of computers and other technologies, they became much easier to use. This is no longer an experimental method. It is now used for clinical purposes. DBS stands for deep brain stimulation. It is a neurosurgical procedure in which electrodes are implanted in a specific area of the brain. Through electrodes, high-frequency impulses affect neural circuits, either stimulating or suppressing certain motor signals coming from the brain. In fact, deep brain stimulation for the treatment of epilepsy has only recently begun to be used. We do not yet have 100% verified studies. However, for patients with epilepsy, the DBS method is already used quite often. An electrode is placed in a specific part of the brain, and the observed effects are very impressive. However, this method is not yet widely used. There is another method of treating epilepsy with neurostimulators. This method is more common and slightly more practical. In the human body, there is a vagus or wandering nerve that runs through the neck. We place the stimulator on this nerve. This stimulator suppresses the activity of the vagus nerve in the same way, thereby controlling epileptic seizures. Its name is vagus nerve stimulator, abbreviated as VNS in English. This method is quite effective, especially for childhood epilepsy. Minimally invasive surgical technique is a neurostimulation method that has been widely used in recent years for epilepsy. DBS performs well in the treatment of epilepsy, but it's too early to talk about figures, percentages of effectiveness. And VNS, the method of vagus nerve stimulation, reduces epilepsy seizures by 60%, but only for patients with the appropriate indications. Please describe the treatment method. How is the surgical operation performed, and what does the system itself entail? To perform DBS, we need to find the right area of the brain. It can be located quite deep and be quite small in size. It is necessary to place the electrode precisely in this area. This electrode is connected to a power generator, which we place in the patient's chest area. The generator is located here under the skin and is not visible from the outside. A special advantage of the method is that we can control the situation. Through a small laptop, we can see the device's operating parameters and adjust them. As for the VNS method, this operation is very effective and quite simple for us, the doctors. The vagus nerve runs through the neck from the brain to the body. We fully expose this nerve and place an electrode around it in the form of a spiral. This electrode is also connected to a power source on the patient's chest and is also connected to a tablet, and we can set all the parameters with this device. We adjust its operation according to the characteristics of the patient's seizures. The duration of the operation is approximately 1 hour. For us, it is a simple but effective procedure. Good neurosurgeons can describe what they do in understandable terms. It seems simple and clear. But their work is one of the most complex fields in medicine. Perhaps that's why getting treatment from neurosurgeons in many countries can be difficult. Follow this link for a whole playlist about the various types of assistance provided by Turkish neurosurgeons. The features of the Turkish healthcare system make access to high-tech types of assistance easier. But that's exactly why you need to choose a doctor more carefully here. The in-depth knowledge of the market, the differences between various clinics and specialists, is the expertise of the specialized service company Healthy Turkiye, which organizes medical visits to Turkey for foreigners and accompanies them during the treatment process. This work is carried out under the supervision of coordinating doctors. This is specialized staff with medical degrees and experience working in Turkish hospitals.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkiye, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home.
How often should the patient visit the doctor after the surgery? At first period after the neurostimulation procedure, the patient should visit the doctor once a month initially. However, once the patient's condition stabilizes, checkups can be conducted every 3 months. During inspections, we check the electrodes, measure the voltage, and based on the observed results, decide whether to make any adjustments or not. And how long can the system operate without replacement and fine-tuning? Actually, this system can work for a very long time. Special adjustments are not necessary for every patient. We have patients for whom we set up the system once, and it works with that configuration. However, in some patients, epileptic seizures are unstable, and there may be more or fewer of them. We want to see such patients more frequently for monitoring. So if the patient is doing well for many months, there's no need to readjust anything. But this disease is very severe, and sometimes monitoring needs to be done frequently, every 2 to 3 months. Turkey offers a unique, comprehensive approach to patient care. In other countries, each procedure often incurs a separate fee. Healthy Turkiye Company manages the organization of these trips based on all-inclusive principle, working exclusively with trusted specialists in both medicine and in the hospitality sector, coordinating all their work for each patient. Healthy Turkiye handles everything, from consultations and arrangements with the clinic and doctor, to transfers, lodging, migration formalities, and translating medical records. You can see the company's website address on your screen. This website allows you to consult and find information about other quality medical services in Turkey. Week by week, we are talking about treating various diseases and serving medical tourists in this country. Subscribe to our channel and stay updated with new videos. We would love your likes as well.